276 Aphorism, Organon of Medicine. For this reason, a medicine, even though it may be homeopathically suited to the case of disease, does harm in every dose that is too large. The more harm, the larger the dose, and by magnitude of the dose, it does more harm the greater its homeopathicity and the higher the potency selected, and it does much more injury than any equally large dose of a medicine that is unhomeopathic and in no respect adapted allopathic to the morbid state. For in the former case, the so called homeopathic aggravation, that is to say, the very analogous medicinal disease produced by the vital force stirred up by the excessively large dose of medicine in the parts of the organism that are most suffering and most irritated by the original disease, which medicinal disease, had it been appropriate intensity, would have gently affected. A cure arises to an injurious height. The patient, to be sure, no longer suffers from the original disease, for that has been homeopathically eradicated, but he suffers all the more from the excessive medicinal disease and from useless exhaustion of his strength. Too large doses of an accurately chosen homeopathic medicine, and especially when frequently repeated, bring about much trouble as a rule. They put the patient not seldom in danger of life or make his disease almost incurable. They do indeed extinguish the natural disease so far as the cessation of the life principle is concerned, and the patient no longer suffers from the original disease from the moment the too strong dose of the homeopathic medicine acted upon him, but he is in consequence more ill with the similar but more violent medicinal disease, which is most difficult to destroy. Footnote: the praise bestowed of late years by some few homeopathists on the larger dose is owing to this, either that they choose low dynamization of the medicine to be administered as I myself used to do 20 years ago, from not knowing any better, or that the medicine selected were not homeopathic and imperfectly prepared by their manufacturers. Footnote 3. A new footnote is added in the sixth edition as follows: thus, the continuous use of aggressive allopathic large doses of mercurials against syphilis develop almost incurable mercurial maladies, when yet one or several doses of a mild but active mercurial preparation would certainly have radically cured in a few days the whole venereal disease, together with the cancri, provided it had not been destroyed by external measures, as is always done by allopathy. In the same way, the allopath gives purulent bark and quinine in intermittent fever daily in very large doses, where they are correctly indicated, and where one very small dose of a highly potentized china would unfailingly help in marsh intermittents, and even in persons who were not affected by any evident psoriatic disease. A chronic china malady, coupled at the same time with the development of psora, is produced, which, if it does not gradually kill the patient by damaging the internal important vital organs, especially spleen and liver, will put him nevertheless suffering for years in a sad state of health. A homeopathic antidote for such a misfortune produced by abuse of large doses of homeopathic remedies is hardly conceivable.